fever, so we have antibodies to fight against the germs caused like bacteria or virus. So our antibodies will kill the bacteria or fungus, and then it protects us from the bacteria and virus. So the same thing when a kid develops a fever, so the antibodies produced against bacteria, it doesn't kill the bacteria, it kills, it thinks pancreas cell as a antigens, that is a bacteria. It completely is a pancreatic beta cell, and there is a no insulin secretions in the pancreas. So the people develop diabetes, what is called a type 1 diabetes. So there is no insulin secretions and all. So we call it as a autoimmune disease. It is our own antibodies which is and causing diabetes. What we call as a sporadic, because parents won't have diabetes. So kid can develop kids when they are growing, so they can develop diabetes because of these autoimmune mechanisms. So there is no insulin secretions, and the kids needs insulin for this survival. So this type of diabetes is called as a type 1 diabetes. And when you look into the community, 10% of the people have type 1 diabetes. So mostly what we are seeing diabetes is a type 2 diabetes, which is what we are seeing in India, the prevalence of more type 2 diabetes. What is type 2 diabetes? So type 2 diabetes, actually the pancreas have insulin, but the function of insulin is not good. That means actually insulin function is to take when you just simply to understand, when you eat three things: carbohydrates, fats, and proteins. The carbohydrate end results is the glucose. The glucose, whenever it goes high in the blood, the pancreas secretes insulin, and the insulin actually acts like a carrier. It takes the glucose from the blood and goes to the cell, and once it goes to the cell, there is one thing called receptors which take the glucose particle and allows the glucose to enter into the cell. So when the insulin receptor is working well, so the glucose can enter into the cell and the energy is utilized. If the insulin receptor is not allowing the glucose to enter into the cell, then again the blood glucose goes high. Then it can lead to a condition called a diabetes. So the insulin receptor, why it is not allowing the glucose to enter into the cell? There are a lot of reasons. One, we can think about genetic, because family history of diabetes can also causes sorry, this can happen at a later age. The current concept is actually why the insulin receptor function is not working. We call as a insulin resistance is due to lifestyle factors, the environmental triggering factors. What we call current is the consumption of high carbohydrate in the activity, and also sometimes the stress is also one causes. So stress can increase the cortisol, that can increase hyperinsulin secretion, and glucose to enter into the cell, making more insulin. This, and even today the sleep pollution is also a lot of these environmental triggering factors we are thinking causing for type 2 diabetes. That is the reasons actually we are getting more type 2 diabetes in the current era, especially in the younger age. So this is the mechanism how type 2 diabetes develop. And gestational diabetes is one thing, is a transient. It happens during the pregnancy in a female. This is due to a lot of hormonal changes happening in pregnancy. Insulin is also a hormone. If there is no adequate insulin secretions during pregnancy, and due to carbohydrate intolerance also, and consumption of high carbohydrate with sedentary lifestyles, there are a lot of gestational diabetes are prevalent. The good thing is after delivery, the glycemic levels can become normal. If the woman is not keeping a lifestyle under control, there is a chance that they can just prone to get type 2 diabetes. And also, a very important thing is, if you don't control the glucose level during pregnancy, the next generation also have a chance to get diabetes. That's the reason we call gestational diabetes as diabetes begets diabetes. And now the latent onset diabetes in adults is a hybrid form of diabetes. Why? Because type 1 diabetes generally starts in the younger age, the child growing age. But the same type of diabetes, what I discussed, autoimmune mechanism, which can happen at the age of 25, where there is a complete insulin reserve is going down. So people, due to the autoimmune mechanism, the insulin secretion is going down. They need only insulin to control the sugar level. This type of diabetes is called latent onset diabetes in adults. So how to detect this kind of diabetes is, for type 1 and type 2 diabetes, there is a simple test called a C-peptide that will just tell us about insulin secretions in the body, and also some antibodies like GAD antibodies, which we can just detect, and then that will diagnose patients with the type 1 diabetes or LEDA. For type 2 diabetes, they don't have any antibodies. As such, it is due to the insulin resistance, and we can just identify the beta cell functions with a simple tester. So this is to understand about the classification of diabetes. So basically, there are a lot of things comes to our mind. What happens when we have diabetes? What are the symptoms basically? So basically, there are three symptoms when you have diabetes. One is polyuria, that is increased urination, and polydipsia, that is increased thirst, and polyphagia, so that is increased hunger. So these three things is a classical symptoms of diabetes. How it happens to understand better. So as such, I told that when the blood glucose is not entering into the cell, the blood glucose just goes high. The blood glucose keep on going high. So there is an organ called kidney which excrete the glucose. So the blood glucose is keep on going high. So the kidney has to just excrete the urine and also the glucose particle in the urine. So when the blood glucose goes high, people start urinating the glucose, and when they urinate frequently, they go for dehydrations. So they keep on drinking water. So that's the reason they feel thirsty, and the glucose is not utilized in the cell, so the cell stimulates the brain to eat more. So because the cell is deprived of energy, so people start eating. So these are all the classical symptoms. When people actually have this kind of symptoms, definitely they have to go for a blood sugar check. And also other symptoms of diabetes maybe like they feel fatigue because the energy is not utilized, and without any physical activity, if people are trying to people are finding they are losing weight, then there is a definite need to check the blood glucose level. Sometimes people can present with the blurred visions, because the common reasons for blurred visions in India is diabetes. So they often go to the eye doctor, and then the eye doctor can recommend for a blood glucose level. And sometimes the frequent infections which is not healing, so we have to think of diabetes. So there are a lot of symptoms about diabetes, even sometimes tingling, and then these are all the neuropathic symptoms people can develop during diabetes. But other thing about diabetes is most of the time you can even present without any symptoms. That is the reason we call diabetes as a silent disease. So I'm just telling all the symptoms for awareness. So if I have a symptoms, then we can just think about to check about the diabetes status. Okay. Now, so we understood the classification of diabetes, we can go for an action. So how to manage diabetes, and also if you have diabetes, so there is a very acute complications called low sugar, that is called a hypoglycemia, and in diabetes, the food care management is very important. So management of diabetes, there are three pillars is very important. One is actually whenever we have diabetes, so definitely the first thing you got to concentrate on the lifestyle changes, the diet and exercise. It is like the king and queen of our kingdom. So when you talk about diet, so I describe about more about diet. That is what the very basic questions comes to our mind. What type of diet? People always think there is something called a specific diabetic diet, but that is not the thing. So it is a balanced and nutritious diet, and also exercise part, which I'll just go. And weight management is one of the important thing, the primary point in managing diabetes. And then next thing is going to be the monitoring aspects. So when you don't monitor, we don't know where we are. So definitely at what point of time when we have to monitor, I will go to discuss. And the medications part. So for type 1 diabetes, insulin is a therapy. For type 2 diabetes, initially they respond very well to the oral medications, tablets, and the long run type 2 diabetes, if there is insulin secretion is going down, they may also require some insulin. So this is how we manage diabetes. When you look into the diet, so nutrition is a very vital part of managing diabetes. There are a lot of myths about diabetes now, become social media is giving a lot of diets because diet. So basically to understand diet, low carbs with fiber first, and high protein in the diet is very important thing. So choosing diet, so you have to just do a complex carb instead of simple carbs. So that can just the simple carbs can just easily increases the sugar level, like taking sweet or adding sugars in the coffee or tea. That will immediately going to have an insulin spike and then increases the blood sugar level. Instead of that, choosing a fiber in the diet. So fiber has a very important role. This is a complex carbs, and also it is not easily digestible. So we have gut bacteria which is going to use the things, the probiotic. So there are newer therapies also coming for diabetes management about the gut microbiota, which is going we can have in interactions also. And other things as when you talk about using the proteins, the protein actually is very much lacking in our Indian diet, because we consume very less protein. On average, we need 1 gram per kg body weight of proteins. So when you come to the Indian whole country, so whether east, west, north or south, there is a Irrigan study called START study has done. They found that Indians use more carb. They are almost in the postprandial hyperglycemic state. That is the reasons they have a high blood glucose level, which is leading to the high insulin spike, and gradually they are getting diabetes in the earlier onset. So concentrating on diet with the low carbs, with high fiber and high protein is very important. So it should be a mindful eating. So when you look into preventing diabetes or even people with the diabetes, mindful eating matters. Choosing the right plate. So have a natural portion control in choosing a diet. So when you have a plate, so first thing what we have to just fit in our diet is take the fiber first and then go to the protein and then come to the carbs. So when you eat this kind of pattern, so definitely we won't consume more carbs. So we can just have a balance in our diet, and definitely this can have effect on maintaining the glycemic level or even in the preventing diabetes also. So being more active is a mantra of just getting preventing from diabetes. So when we do just walk, so when you improve physical activity, it is always helpful in a lot of improvement in our metabolic conditions. Not alone bringing the glycemic level, so it can just improve the hypertension, the blood pressure control, and also there is a reductions in the cholesterol level, and also have a mindfulness, improving the good happy hormones and thing like dopamine, oxytocin, serotonin, endorphin, all those things are released when you walk. So basically, the American Diabetic Association's guidelines recommend that 150 minutes per week, that is 30 minutes daily, at least 5 days a week if you walk. So that will lead to metabolic health. And also along with walking, so you have to concentrate on strength training exercise and cardiac workout. So even some isometric exercises, all those things which is going to improve the muscle, because that is a very important thing. When you make your muscles move, so definitely we can make use of the cells widely, that is insulin properly. The insulin become more sensitive, the glucose is easily absorbed in the cells, and that can lead to reductions in the glucose level. So physical activity is a very important cornerstone in managing pre-diabetes or a diabetes or preventive aspect also. The medical management, I'm not going to deal with much, because when you detect diabetes, there are a lot of medications available. The good thing about the medical management in the current era is, even though the prevalence of diabetes is very high, today we have a lot of good molecule which is just there given for diabetes, that is having impact on a good impact for heart and then kidney protection also. So molecules like sodium glucose transport inhibitors and then GLP-1 analogs, which are all the newer molecules has come to the market today, which can be used even in the earlier stage of diabetes itself. So current era of treating diabetes is not alone glucose centric, controlling the fasting, the postprandial or the HbA1c. Today we are just mainly concerned about preventing them from getting into any complications. Always one thing comes to our mind when you treat diabetes, that people with diabetes, they may develop cardiac problem, heart problem or kidney problem or foot ulcerations, everything. But now actually the focus of treating diabetes is changed from preventing them from getting into complications with these newer molecules. That really a game changer in today's diabetes management, and we are often starting them earlier so that we are preventing them into getting into complications that can lead to the quality of life of the patients whom we are treating. So insulin therapy, actually it is recommended only for type 1 diabetes, and also it can be used for type 2 diabetes when the long run, when the insulin secretion is going down, and at one point of time type 2 diabetes with poor control, so they may need insulin also. There are currently we are living in 100 years of discovery of the insulin. There are different type of insulins are available, very short acting to the long acting, and even we are getting currently going to get once a week insulin is also available. So this is a development in insulin therapy, and which kind of patients requires, we have to just give insulin. So the cornerstone of treating diabetes is, main thing is not only diagnosing and then managing with the medications. The main thing is monitoring is very important. So that is a very important thing, to have a proper glycemic level, so that we can just prevent any complications like going for a low sugar or a high sugars. So earlier we have a self-monitoring blood glucose, that is with a glucometer. So it is like a pulse oximeter. During the COVID, what we just check the oxygen saturation. This is a very simple thing which can we can do it in the home itself. So they can monitor the blood glucose whenever they feel giddy or they need to just to check the glucose level. They can do it any point of time. But today actually we have one thing called continuous glucose monitoring system, that is called a CGMS. So this is actually a sensor based monitoring where the sensor is fixed in the home. It monitors the blood glucose continuously every 5 minutes, and once you fix the sensor, it will be there for 15 days, and it can be monitored in your mobile, and also it can be monitored real time by a treating physician also. So the real time continuous glucose monitoring. So the advantage of using this continuous glucose monitoring is to give a precision diabetes care for people with the diabetes. So where we can just interfere with all the issues like about how the diet is changing the glycemic level, how we can adjust the diet pattern, and also the medications part we can just easily adjust, and we can avoid nighttime low sugars. That is a very important thing. People with what we call as a brittle behavior of diabetes, so often they have a low sugars, so they cannot check the sugars levels during the night time. This CGMS will identify, and then it can just alert both the physician and the patients, and then we can prevent them from getting into often low sugars also. So this is one thing, very important tool which is now available, and this technology changed the way we practice today. So we can give precision diabetes care with this continuous glucose monitoring study. So always people with the diabetes, they fear about low sugar. So that is very important just to know, understand what is hypoglycemia. So hypoglycemia is defined as when the blood glucose level goes less than 70 milligrams with the symptoms like dizziness, confusions, all the things, then definitely it is a hypoglycemia. So it can be classified as a mild, moderate, or severe. So mild hypoglycemia, if the patients experience blood glucose less than 70 with the symptoms, they can follow a 15-15 rule. That is actually first thing, they can just eat 15 to 30 grams of carbohydrate, whichever is easily available. So they can take a glucose 15 grams in 100 ml water, then mix it and they take it. Wait for 15 minutes and then they can recheck the blood glucose. So still if it is less than 100, take another 15 grams and then after 15 minutes they can monitor. So if they are recovered within that, then it is a mild, and if still it is high, they can just call the diabetic team, and then now they can just have the treatment immediately in the home, or they can get taken care to in the hospital also. So this is about how hypoglycemia can be corrected in the home as well as by the medical time. So to understanding, I'm just giving the causes of hypoglycemia. Why hypoglycemia? There should be a cause and effect, because we should understand all people don't experience hypoglycemia. If the patients are experiencing hypoglycemia, there should be a specific reasons for getting hypoglycemia. Basically what happens is the dosage error. So people can just take some wrong dosage and then they can experience hypoglycemia. The other common thing is actually after taking the medications, they don't take the meal properly at the right time. So that can also lead to hypoglycemia. And suddenly people actually from the regular exercise, they increase the intensity of exercise. So then they have to correct the medications. If not, then they can go for a hypoglycemia. And sometimes infection can also causes hypoglycemia or even hyperglycemia also. So whenever they sick, that we call it as a sick period. So sick period management is very important. During sick period, chances of hypoglycemia, the patient experience fever, the appetite, the food intake goes down, so they may experience as low sugars. So we have to be very careful. These are all the places where people can go for a low sugars, and they have to take action to prevent hypoglycemia. So foot care actually is very important in diabetes, because foot care is equal to face care in diabetes management. When you take care of your feet properly, so we can prevent you from any complications. So must foremost goal is to good glycemic control, and then next you check your foot every day. Like checking your face, you have to watch for your face, you have to just use a mirror, and then you just basic thing is don't walk barefoot, and you can use moisturizer. You can just watch for any simple corns or calluses in the toenail. Don't use self treatment for nail hitting. You can just get the advice from the podiatrician or your physician, so they can just definitely help you. And foot care is very important tool. If a simple injury is can cause into even amputation level also, we are seeing often with the poor glycemic control, people are getting a gangrene, because there are a lot of complications can happen when the foot care is not done properly. So that is very important cornerstones in managing diabetes. Foot care is very important. Now come to the final talk about the wellness. What is wellness, metabolic wellness, and very common things which today we are seeing is diabetes reversal. What is the science behind diabetes reversal? When you talk about the metabolic wellness, so currently now we are moving forward in not only managing the diabetes as a holistic approach, because the metabolic wellness is one thing very important. Your weight can give idea about your health risks, so because actually weight matters. So if you lose weight, you're going to gain life. So the weight can just have impact in a lot of ways in our body, and processing your fats and also sugar, which can just lead to insulin resistance, and that can leads to the in a high amount of fat deposit in the organs, like or the fat, liver, and then the pancreas, which we call as visceral fat. So this visceral fat is going to cause more insulin resistance. It can not only going to cause diabetes, but also can increases the cholesterol, and also can increases the blood pressure. So all these things, making a simple lifestyle changes can definitely make a metabolic health. So the metabolic wellness is a very important talk today, and at Kaveri we are going to start a metabolic wellness clinic to improve the metabolic health. So the base to improve the metabolic health, first thing is currently actually the excess weight. how the weight reduction is going to help. So people with obese, so when they lose almost 5 to 10% of weight, so definitely there is a improvement in their glycemic levels. If they lose 15% of weight, body weight, then they can just go for a complete reversal of even people with pre-diabetes to diabetes. They can have a reversal. There are elegant study done by Dr. Roy Taylor in New England. So they found out that with proper weight reductions and a calorie restricted diet, so people can just even at the initial onset of diet up to 5 years of diabetes also, they can with a high A1C, they are bringing to the normal stage. They are going for a pre-diabetes stage to the reversal of diabetes also possible in these conditions. So aim for a healthy diet. So healthy diet in the sense actually choosing right kind of carbs, like choosing a complex carb with proper high protein and high fiber in the diet, and avoiding too much of salt in the diet. So all these things, avoiding the saturated fat or trans fats is very important, and regular exercise is important. So that can just help in maintaining the weight, and avoiding too much of abusing with the smoking or alcohol, and some mindful pattern of eating is very important. So all those things going to change, improve the metabolic wellness. Now coming to what is diabetes reversal. So people always ask whether diabetes reversal is possible, but the right term is actually to understand what is diabetes reversal. If the people with the diabetes, the HbA1c are around 7, we always start with medications and lifestyle. So they want to just go for a reversal stage. First thing what we do is bringing the HbA1c to less than 6.5, reducing the medications, and if they achieve the HbA1c of less than 5.7, so we can just stop the medications and then go with the lifestyle therapy with a diet and exercise, and they can able to achieve the HbA1c less than 5.7 for more than 3 months time. Then we call it as a diabetes remission. So long-term diabetes remission, like more than 1 year, then we call this as a diabetes reversal. But a complete reversal is in the hand of the individual whom we are treating. So the right term will be a diabetes remissions. For long-term diabetes remission is currently possible with proper lifestyle therapy. So and calorie restricted diet, the diabetes remission is one thing which is currently achievable, which is not a concept previously, but now things are changing. So we can able to, we have a strong science evidences about diabetes remission, and we are also even see in our practice also people are going for a diabetes remission. And one thing we should understand, type 2 diabetes we can go for a diabetes remission, where type 1 diabetes they need insulin for the survival, so that is not possible in a type 1 diabetes. So type is remission, that is you are going for a remission stage if your HbA1c is less than 6.5 without any medications, so managing for more than 3 months, then we call this. If the A1c is going high, again they can go back to the diabetes stage. Now, so coming to the end of the talk, actually what are the effective ways we can control diabetes? So we have to have a holistic approach. First thing is the cornerstone is physical activity, improving the lifestyle changes, improving, concentrating on the exercise part. 30 minutes daily, 150 minutes per week, at least 5 days a week if you do, along with the strength training exercise. And then managing stress, because people currently without stress nobody is there. So how to manage mindful things, what we can do, breathing exercise. Currently improving the belly breathing is one thing where we can improve the parasympathetic nerves, and so that we can just reduce our stress. This is something we can do by yoga or meditations that we can do. And also we are currently losing the social relationship, because most of the time they are on the social media. So we have to have like social media restrictions, and using physical connections with the people. And improving the sleep is one thing very important, because actually sleep is one thing what we have just observed is the brain pruning is happening, where the new nerve cells are happening only when you have a good quality sleep. So currently this generation is lacking sleep, so we have to concentrate on improving more sleep, and avoiding the substances like tobacco, alcohol, and substance, other drugs, everything. So we have to just and main thing is the focus is on a healthful eating, the mindful eating. Choosing the right diet is very important. Avoiding too much of trans fats or fast food item. So using raw fruits instead of processed food is very important. So when you just take care of all these things, definitely we can able to control diabetes or prevent diabetes, and even we can have a healthy life. With that, I just end my talk. Thank you, and have a discussion.
Thank you so much, Doctor. Thank you so much. And would you like to take few questions from the chat box? And
Yeah.
would you be able to see that? It
Yes,
starts
sir.
from I'm diabetic
Yes,
for 10 years. Yeah,
okay.
please, Doctor. Please.
Okay, so there is a question from Mr. Ravi's. Thanks for the great session. Thank you. Say, need some idea on patches people wearing on their shoulder, especially have seen in many runners. I'm a long distance runner, so be curious about it. Okay, so definitely the patch what we are seeing is the continuous glucose monitoring. It's a sensor, ambulatory glucose profile, we call it AGP. So this sensor will monitor the sugar level. Since you are a long runner, definitely actually you need. I think you are not a diabetic, so you can just see whether because of long running you are experiencing any hypoglycemia. That really helps. And for a regular monitoring for general health, you can just use the sensor. So this is approved by FDA also. So definitely we can just use it to see how your diet is impacting your glucose level. We can see the because of the diet how the sugar level is going fluctuations. So it gives a 24 hours monitoring so that you can just plan your diet accordingly. So since you are a long runner, you can just help you in what type of diet you can just take it and also prevent aspirin hypoglycemia. So I'll take another question. There is a question. I'm a diabetic. There is a question from Mr. Nagaraj. I'm a diabetic for 10 years now. I'm regularly using medicines, regulating my food, and doing a lot of walking every day. In spite of it, my sugar levels are not in control. Should I go for insulin? My doctor has not yet prescribed insulin. Okay, so main thing is actually, I think for him, 10 years diabetic. So definitely he's on food and physical activity is good. Then the medication parts need to be adjusted. So since 10 years of diabetes, we have to check the insulin secretions in the body. I think the doctor can just see a simple test called C-peptide and insulin assay. So that depending upon the insulin secretions, we can just advise you whether to go with some insulin therapy, or even we can just adjust a newer medication also to control the sugar level. What food can be, this is a question from Mr. Sharir. Actually, what fruits can be consumed without worry of diabetes? So basically, actually, we can just recommend low glycemic fruits. So like apple, papaya, guava, even actually avocado is a very good, which is not, which is going to be very healthy fruits. So it is available. You can just take it. So to avoid high glycemic fruits like mango, banana, chiku, we can take it in a moderate. But generally, all foods can be consumed in a moderate. That will be anything. Why is diabetes increasing among young adults and teenagers today? This is a very important question which I just want to answer, because previously the diabetes is thought to be arises in the fourth decade, but currently we are getting diabetes in the second decade. The reason is actually there are multiple factors which I just already mentioned, that the lifestyle, the environmental triggering factor. So first thing is there is a change in the food habits is happening. So since availability of a lot of apps to deliver food in the home from the office itself, they take untimely food. So that is happening. The calorie restriction is not happening. So easy availability of high calorie diet is one reason that I can just recommend. So every time you take more high calorie diet, the insulin spike is happening. So keep on just overworking insulin can also leads to the insulin resistance and causing diabetes. Second thing is after eating high calorie diet, there is a less physical activity. There is no because people always often says, doctor, I don't have time. So there are 24 hours. There is no 1 hour that is not available for their own health. So the primary important is always we talk health is wealth. So hit early. Always the finance things you discuss about start early. So what today I tell to the younger generation is for health you have to start early. So health investment is a very important thing. What the young generations in India is need of the hour. So they have to concentrate on physical activity. The other thing is actually indirectly more stress is happening because of a lot of competitiveness to survive. So in this era of artificial intelligence, so they work with things. So avoiding managing stress is also very important, because stress it can always keep it in alert stage by increasing the cortisol level. This cortisol overworking is not good. So that can leads to insulin resistance. So that can cause hyperglycemia. And also like one thing like intermittent fasting, you need a mobile fasting also. So every time, because the generation is in the Insta or thing, social media, the mobile fasting is also important when they should have time for the sleep. So if they consider all these things, definitely we can just have prevent the diabetes in the younger age. So we think that India is a diabetes capital, but we can just think India is a diabetes care capital also. This is possible with awareness like this. So people should understand about diabetes. so they can prevent the diabetes itself. That is possible. What are the steps to be taken for diabetic patients' food care? So this I just explained. So the food care is very important, like your face care. So every day you have to watch your foot in the mirror. If you take care of it properly, so you can have a healthy diabetic life. So தமிழ்ல சொன்னா வாழ்க்கை ஒன் கையில்ற மாதிரி diabetes one கால் பாதத்துங்களில் அப்படின்னு சொல்லலாம். So your diabetes control is in your foot. So use your food wisely. So definitely your diabetes will be under control. Manage diabetes properly. We can manage. How to identify and address from patients' side regarding sickness care? Yes. So sickness, the sick period is very important in people journey with the diabetes. So if people are having diabetes, so they have fever, sometimes they experience fever, or sometimes they may have some infections. That time the dosage we have to just inform the treating doctor to adjust it. So because your food intake is going down, so you cannot take the regular medications, that you have to adjust the dosage to prevent like a hypoglycemia, which is all. At the same time, high sugar can also happen due to infection. The dosage to be corrected, and immediately, actually, if you have a fever, you can consult with the doctor, identify where is the source of infection is going to happen. And also very important things when you travel also. So if you have a sickness, what kind of help you need to take care, that you have to get advice from the treating doctor. So there is a question from Mrs. Amba. My mother is 83 years old, and sugar levels is normal for her age. Sometimes I haven't seen her into going hypoglycemia. What are the precautions we can take at home to take care of such situations? Actually, elder age, actually geriatric people with the diabetes, so definitely the chance of hypoglycemia, one reason is the intake. So if the intake is not good, then there is a chance of hypoglycemia. So frequent meal will be the better choice, and identify where the hypoglycemia is happening. The continuous glucose monitoring study is also one thing which will help them to identify when they are experiencing hypoglycemia, so that we can giving the importance of nutrition, like even increasing the protein rich diet to prevent the hypoglycemia can also possible. Does fasting help in controlling diabetes? Okay, so actually people with the diabetes, they should not go for fasting without the advice of the treating physicians, because diabetes management is individualized. So it depends upon the patient's medications, and so if they want to go for a fasting, so definitely in the early stage pre-diabetes or short duration of diabetes, without the advice of physician, don't take it. But I think fasting is there are a lot of things about the fasting, the intermittent fasting we talk about, that have a lot of beneficial effect. But people with the diabetes, they need to be under the supervisions, so that can help in reducing the medication is also possible. If they are highly motivated to go for a fasting, that is good, but without the consent of the doctors, they should not do it. They cannot try, because sometimes they may experience a low sugar. That is a very common thing they can have it. Can neuropathy or retinopathy be reversed? Yes, actually a very important thing, because whenever we have people with diabetes, the first complication they can develop is the retinopathy. Because of high blood glucose level, there are some advanced glycation end products like sorbitol which releases in the eye, that can lead to retinopathy. That's the reason instead of checking the blood glucose, they will be visiting the eye doctor. So the first thing is, if you bring the sugars under control, these things can be even reversed at the early stage. So that is a very important thing, sir. So if they have earlier retinopathy, so that is the reversal is possible. Same thing in neuropathy also. We call this as a crying for dying stage. That means initially when they have pain, pricking sensation, so that stage, if you control the sugar level, definitely we can reverse this condition. If glycemic level is not controlled, they don't have any symptoms of the tingling or pricking sensation, they can have a sensory loss, so they can go for even some ulceration also. So early stage, definitely it is possible. It depends upon which stage of diabetes thing. I am diabetic for 10 years and also under medication. My glucose level 3 months average is 6.9. Can I reverse diabetes? I have a history of diabetic in maternal family. I used to walk regularly. I don't feel hungry too, so I used to skip food at night. Is it good? Yes, actually, since our HbA1c is 6.9 with the 10 years of diabetes, definitely with a proper good lifestyle, we can just think about going for HbA1c to less than 5.7, and we can even try for without medication also. So kindly consult treating physicians. Definitely they will help you. What is the symptom for identifying diabetes? I described in detail about the frequent urination, thirsty feeling, increased hunger. These are the classical symptoms, but also without any physical activity, if people experiencing weight loss, they can have diabetes. This, so if you notice this type of symptoms, then we have to think whether we have to go for a blood sugar check. How reliable are digital tools like CGMs and smart devices for monitoring diabetes? Yes, actually, this is approved by the FDA, CGMs, continuous glucose monitoring study. So we can just rely on it. It gives a pattern. So, and also there is one thing called the time in range concepts. So this when you do a continuous glucose monitoring, now we are looking for about how to manage the glucose level with the concept of time in range. That means actually, so they keep the range like 70 to 180 milligrams. Around 24 hours, if people are maintaining around 70 to 180, like 16 hours to 30 minutes, if they're maintaining this range, then they don't have any complications in the future. So this is how we are now interpreting the continuous glucose monitoring. So we can rely on the CGMS in our practice, and this technology is going to be the future. So definitely we can rely, and it is now we have a precision CGMS also coming. So previously when it is introduced, there are some errors. Now we have very good sensors, smart devices are available. This we can rely, no issues. My father had diabetes, and many people say that I'm at a higher risk, even though I follow strict dietary habits. Okay, Spushpalata madam has asked, definitely I'll just answer because even though the family history is there, so currently what I say is Indians are very prone to get diabetes at any point of time. So we are genetically predisposed to it, but at the same time, good thing about if we change our lifestyle, definitely we can prevent from getting into diabetes. It's not that only the family genetic risk; it is in our hand. If lifestyle is changed, definitely we can prevent. And also regular monitoring is important. If we do that, definitely we can prevent diabetes. So what is the life of CGMS? CGMS, when you currently we have CGMS for 15 days, but in the near future it may actually in abroad we have since CGMS for 3 months, but in the future in India also it will be available. Currently we have 15 days.
Yeah, there are some more questions, and if any of the participants have any further questions, you can directly send it to madraschamber@madraschamber.in. That's a mail ID which we sent you. You can just take those questions and get the reply from doctor and send it back to you. And thank you, doctor. It was truly a meaningful and informative session. And I'm sure we all gained valuable awareness from today's talk. Thank you for your participation and encouragement too. We would now like to invite Mr. Sendil, who is the co-chairman of our Healthcare Committee, MCCI, to give a vote of thanks. Over to you, Mr. Sendil.
Thank you, Logo. Hope I am audible. Right
Yes,
now
it's
I'm
audible. Yes.
out in Orissa, and on behalf of the Healthcare Committee of Madras Chamber of Commerce and Industry, it's extremely a pleasure to have a seminar on diabetes by Dr. Parnidharan. On his busy schedule, he made a point to give a lot of inputs. And thank you, Dr. Parnidharan, sir, and for all the 50 plus participants who have come online. And it's a wonderful thing to be part of this initiative thing from our chairman, Dr. Ayyappan. And once again, I thank each and everyone for being a part of this wonderful initiative. Thank you so much.
Thank you. Thank you so much, sir. Thank you so much.
Thanks, everyone.
Thank you. Thank you so much, sir. Thank you. Bye.
Thanks.